tough skin to make sure that these things stay on. And I don't know what you do. It's nice and sticky up here. That's not where I want it. I must have missed. When you put it on, you just give it a really light dusting with your stuff. You don't sit there and squirt till it's dripping off your foot. You'll never get the tape on. So just a little bit. The first tape job is called the Lodi tape job, and the Lodi tape job actually is to put the transverse arch back in the forefoot. That's really what it does, and it readjusts the metatarsal bones and the tarsal bones behind them. This is a really useful tape job if somebody has shin splints, by the way, and if they get that pain up in the lower 1/3 here. It's always good, if anybody starts getting pain here, they should go and see a doctor and make sure it's not anterior compartment syndrome or tibial stress syndrome, stress fracture of the tibia. And if it's not those two, if it's just the interosseous membrane, then you can tape for it to try and hold this cause, because these bones are spreading too much and putting tension on the interosseous membrane. This is a really good tape job for it. It's also really good for people who are having pronation issues. And in a clinic that I worked at in Seattle, people came in and we did biomechanics on them, looked like they might need orthotics. We would always put this tape job on them first for about 4 or 5 days and just wear it around, and if it helped, then we would fit them for orthotics, because it costs $400 to sell orthotics, and it's a cheaper way to find out if it would work. So we're going to be putting some half-width strips. And I could even go slightly bigger than half-width on his foot, because it's a pretty good size, and I want to cover, make sure I get good strength on it. If I was doing a little petite foot, certainly that would be adequate enough. But these start on the head of the fifth. So I'm right on the side of the head of the fifth MTP, or the fifth MTP joint. And I'm going to go around the back here on the bump, and it's a good idea just to take a piece of tape or a Band-Aid if you have it, so a little more comfortable, and just put it over the skin here so that you protect the skin, because there is going to be some pressure on it. And I'm just going to wrap that around there, and then I'm going to bring it back here, take a measurement on the side of the fifth. And remember that the Lodi tape job goes from the sides, from the side of the fifth to the side of the first. Okay, always the side. So I have to do a manipulation, and what I'm going to do is reconstitute his transverse arch. So the important thing is, first of all, that he has his foot relaxed all the time. And then I'm going to use my thumb and find the second MTP joint. So I get the second MTP joint and then lift his foot up into neutral position with my thumb underneath the second MTP joint. I'm right under it. The next thing I do is check his tibialis anterior tendon to make sure it's slack, which his is. This is a lot of, it's difficult. Most people will pull the foot back for you. As soon as you start lifting it up, if you notice him, he started to do it and then he relaxed it again. But most people can't do that. And if you say, just relax that, they'll have a lot of trouble relaxing it for some reason. So to get them to do it, just do some reactive inhibition. Say, just push lightly against my thumb with your foot, and it'll just collapse. So once I get that, and that's imperative that it's slack, I push down on the first MTP joint. So what I'm doing is lifting up with my thumb on the second, push down on the first, and I make that arch through the foot. Right? Up on the second, down on the first, and I make this arch through the transverse arch in this foot. And while I'm holding that position, then I pull on the tape and stick it right on the side. So just going to do it one. Check that tendon, down on the first, pull on the tape, stick it on. on, this should be really, really tight like that. I want it to stick out like that. Now I can do very little overlapping here. It doesn't matter so much on the lateral side. There really isn't any issue out here at all. But for example, on this one, I do not want to get this. If I were to put this piece right there, it would ruin the tape job, because this is going to pull up on and destroy my little arch that I'm trying to create. So I want this one to go down a bit from that first one. You have to make sure that there's no pull up, because I'm pushing it down. I want it to stay down there. So again, I'll grab the second, lift it up into neutral, down on the first, pull on the tape and stick it on. I'll put a third one on. And do the same process every time. Thumb under the second, up to neutral position, check the tendon, down on the first, pull on the tape, stick it on. Once I get all three of them on here, then I can pull these into the arch. And that's typically what will happen, is his big toe will come down and out. He'll be pointing down and out like that. It doesn't always happen. He's got a good arch in his foot, so it really happens. Some people with planus feet, it doesn't happen at all. So to finish this off, I'm going to start just forward of the heel, and I'm starting just at the base of the malleoli. And you always start on the lateral side, go under the foot, and up the medial side. So, and I just take your fingers in the arch, like that, so that you're giving some support to the arch. And as you lay the tape in, just slide your fingers out. And half overlap these and bring them all the way forward through the arch. Just up to the MTP joint there. And that's good enough. Now if this looks, some people just take a piece of tape and do that. I've seen tape jobs where they actually start by putting an anchor here and go all the way around, and then do the tape job, put these straps up, and then put another one over here, and that's pretty tight too. Good looking way to do it. This is just this stuff is just cosmetic. I don't even do that. When I do this tape job, if I do it, I'll pull it back, make sure I stay away from those exposed tendons, and then just make sure that these don't come off in the sock. Put a little X over top of it to make sure that these don't sort of curl down in the sock or something like that. So there's different ways of finishing it off, but none of this stuff is important to the function of the tape job. The tape job itself is really this arch. So when I look at his transverse arch now, it's bigger than it was before. The skin's a bit scrunched right into here. Now, if he gets down on this because he has a normal arch, this would just tear his hair. He wants to get it off his foot. This is so uncomfortable. If somebody can use a Lodi, as soon as they stand on it, they go, oh, yeah, that's nice. It feels really, really good. So if it feels good, you know that it's probably going to work and they'll get some relief. But, if they have a normal arch, if this isn't the issue, that guy gets really uncomfortable.
Why are they called Lodi?
That's a good question. It's a question I can't answer. I have no idea. Lodi, yeah. It's actually, the tape job was I think started by,